Now, while the Indian Medical Association is yet to come out with its reports on how many doctors have been affected during coronavirus, Dr. Rajeev Jayadevan, president of the Indian Medical Association's Kochi chapter, has actually collated data based on an elaborate media and social media search. It's not a scientific analysis. According to him, between 8th of April and July 9th, 108 doctors lost their lives due to coronavirus. Our reporter Milan Sharma spoke to Dr. Jayadevan. Listen in to what he has to say.
So, Doctor, what is the figure that you actually arrived on after doing all your research?
Yeah, the figure that I have now is over 110. Over 110 doctors who have passed away. The title I used for this project or tribute is called Deaths During the Times of COVID-19. So I use the word during
so
the time.
You're saying that these doctors have passed away due to coronavirus?
Due to the pandemic. Now, the pandemic can affect you in many ways. The pandemic can affect you as a virus. It can affect your lungs, and your immune system can destroy your lungs and kill you. It can affect your immune system in other ways. Other organs can fail. It can kill you. You may get the virus and you may die from other causes. So just because you have the virus, it doesn't mean that the virus killed you. You may have died of some other disease. So where possible, I excluded those people. But, from a news media report, without looking at somebody's medical report, it's extremely difficult to say that. And then there are many people who are working amongst COVID patients and died, and these deaths were attributed to COVID. Now, these were also reported not only in news media, but also in social media. So these were also counted as long as they seemed legitimate. If it could be, whereas on the other hand, if this person, let me finish this. On the other hand, if this person worked in a COVID ward and died of, let's say, some other known disease, then those people were excluded. You were asking something.
So is this the official data that is released by the IMA, or these numbers have been collated by your own self as your own data assessment?
Yeah, this is the result of my own work for the most part, but I did contact as many colleagues as possible to give me information. But to my knowledge, there is no official publication from any organization about this yet. I'm hopeful that everyone is working on it, because this is an extremely important bit of information as we plan for the future, because the pandemic is going to stay with us, and we need to know to preserve our healthcare resource. We can't replace these people.
Let's then go straight across to Dr. Rajan Sharma, National President of the Indian Medical Association. He joins me from Faridabad. Dr. Sharma, let's get it clear. Is there a report or is there not a report that between April and July, 108 doctors have died in the line of duty? And if they have, why is the IMA reluctant to reveal this report and come out with the details?
Rajeev, good evening. First of all, I am speaking from Yamunanagar, Haryana. IMA was and will be never reluctant to release this data. Rather, I must share with you the first where a colleague we lost to COVID. Immediately, I had set up the National COVID Registry, which was functioning. It initially had its hiccups because the most important aspect of the resident doctors was missing into it. And now we have got a substantial data which is fully authenticated and includes all the practitioners of modern medicine.
Can you tell our viewers, because I want to know, can you tell our viewers, is it right therefore can you confirm to us that 108 doctors, health workers have died in these 3 months?
It is not 108 doctors. As per the latest count till now, it is 97 doctors and 1,279 doctors have been infected. That includes less than 35 years, 771.
Yes.
Above 35 to 50 years, 247. And above 50 years, 261.
Sir, I'm going to flash what you're saying. You are telling me 97 doctors, you are officially confirming to us that 97 doctors have lost their lives in India between April and July. Am I correct? And more than 1,200 have been infected by the virus.
Repeated exposure clubbed with poor quality PPE kits and masks in the initial days, erratic work schedules and pending salaries, all of it together has taken a toll on the doctors, both mentally and physically.
The IMA has indicated that they are in a process of releasing such a report that records how many doctors, nurses and healthcare staff we've lost due to the coronavirus pandemic. But we often forget, while they may be working like doctors under PPEs, just like you and I, they are also humans and their mental health also needs to be addressed.
Over the past few months, many healthcare workers have also flagged concerns over safety and long working hours, putting at risk the lives of those fighting the virus from the front lines, highlighting the lonely and deadly toll of those on COVID watch.